Today, I am thrilled to have Dr. Drew Pinsky, who is an internal medicine, addiction medicine specialist, and the host of the Dr. Drew Show. So, welcome, Drew. And I have lots of questions, but
Good. It's just a privilege to be here, and thank you for everything you've done and everything you've had to go through. I'm so grateful.
well, before we get into the meat of it, I want you to know I looked you up on Grok and I said, give me some interesting facts about Dr. Drew Pinsky.
Okay.
Okay. So apparently you're an opera singer. Is that
Yeah.
is
I,
that
I
correct?
mean, I trained for many years. I used to get sort of sold at charity events and things to sing stuff, and then I sang national anthems for the Kings and the Dodgers and stuff. But to call myself an opera singer now, I'm not sure. I'm not sure is an accurate description.
That is really cool. Do you still do it at all, like
I
recreationally?
was in I was in the Masked Singer about 6 years ago, season two of that. And when I was getting ready to prepare for it, I was like, "Hey, something is wrong with my whole what's called the passaggio in the opera world is vanished. What's going on here?" So I got a laryngoscopy. Lo and behold, I have a varice. I bled into that
Oh
varice. I have
no.
reflux. I had to get vocal rehab and all this
Oh
stuff.
wow.
And if I really want to get my opera back again, I'd have to have laser surgery, which would mean 2 weeks of silence, which I don't have.
Wow. Well, your voice sounds excellent though. I
Thank you.
mean,
Thank you.
did you have a good ENT helping you?
I did. He was great. And he gave me a little mini lecture on how the chords moved. It was kind of fun.
Oh, good. All right. Well, the second thing I learned about you is you have an asteroid named after you.
It's true. It's true.
Okay.
So, a super fan of my radio show was an astrology professor at University of Massachusetts Amherst, and I went to college at Amherst College, which is down the road from there. Or maybe he was at Holyoke or something. But anyway, he became obsessed with us, and both Adam and I both were given asteroids.
That's really cool. Is that asteroid? I mean, do you track it? Do you know where it is?
No,
Like,
no, no. I just
yeah.
I thought it was a lovely gesture, and that's where I kind of left it. But it comes
Oh,
up once in a while.
all right. You have triplets. That's
I
very
do.
coul.
Yeah.
You've
Survived that somehow. I don't know how. And now that we have a grandchild again, we're having PTSD, flashing back to all that, and still don't know how we survived it.
what's it like being a grandfather? Is it much easier? Is it what they say it is?
No, it's easier. It's weird. It just smacks of old, and
Yeah.
but it's lovely. It's everything everybody says it was. And I'll just tell you a quick story about surviving triplets. We had this brilliant high risk obstetrical team. And the guy that was our team leader sat us down and he goes, he became a good friend of mine. And a neurology friend of mine described his knowledge base as encyclopedic. And I thought, yes, that describes his knowledge base. And he sat us down. He goes, don't do this. And we're like, huh? He goes, I will get you three healthy babies. I will deliver three healthy babies. But he just pushed across the table. Let me show you the literature on the probability of marriages not making it, the
Whoa.
mental health of everybody and the relationships suffer. Don't do this, have twins. And we just couldn't
Whoa.
do it. So we had triplets.
Wow.
Yeah.
Yeah, I had a similar experience. I had fertility issues. I actually have four kids. And the first one, was a struggle and it just got
Yeah.
easier and easier. And the fourth one was a
Yeah.
whoopsie, right?
Mm.
And my OB has four boys and I have four boys. And I had my first one, I had my last one 5 years after my first one. So I had him really compacted. But he pulled me aside. He's like, "Are you sure you want to do this?" Like,
Yeah, I mean,
and
but I felt like a poker player. Took all my chips, and just went, okay, we're just all in. If you
yeah,
really go
well,
all in, and obviously you and I have had some professional training and shown that we can tolerate a lot of stress. That you just go all in and you can do it. That's all. And I wouldn't have had it any other way.
yeah, yeah. No, I'm horrified that that
Yeah.
conversation even happened in retrospect.
Yeah.
I probably
Well,
should have
I get why they do it. They feel kind of an obligation to it and stuff. And the literature was there. It did not look good. And it's funny when I was a chief resident. the assistant administrator and I ran the residency program. She was instrumental help to me. And halfway through the year, it was like, December, she comes up to me and she goes, "You got to meet in my office. I have something I got to tell you." And I go in there and she goes, "I'm not going to be here the second half of the year." I thought, God, what am I going to do without her? And then she goes, "I'm having triplets." And I thought, oh my God, that's bizarre. Who has triplets? Oh my, I was like, triplets. Oh my goodness. And I bring it up only because of God has a way of
Right.
has a good sense of humor, let's say. And her marriage didn't make it. And I
Yeah.
remember watching that and going, okay, well, there you go.
Wait, was she a resident when she got pregnant with triplets?
No, no, no. She was the assistant director of the residency program, and then I
Oh,
was the chief resident, and she just was really helped me run the program. I mean,
yeah.
it was a very intense experience to running a residence. I don't know if did you ever do a chief year?
Well, you were automatically a chief. I mean, if you survived your fifth year, you were a chief. So
Yeah,
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 it wasn't, it was, we
yeah.
were all the same footing. I mean, but you studied internal medicine, right? And then did
Yeah.
you do a fellowship in addiction, or did you just sort of decide to hone in on
No,
that?
that's an interesting story too. I started moonlighting at the psych hospital. I was neuroscience and brain was always my thing in college. This opportunity came up to moonlight at a psych hospital when I was a second year resident. I thought, oh, I'm going to go do that. It'd be interesting, get to sharpen my psychiatric skills. Little did I know I was going to spend over 30 years in that hospital.
Oh, wow.
And ended up becoming very good at the medical management of psychiatric patients. And then, of course, all the medical problems that I was being asked to see as the years went along, down on the drug unit. I got very good at drug withdrawal. There was a program director of that chemical dependency program at that hospital who made drug withdrawal a discipline. And I worked at a county hospital with alcoholics and heroin addicts all over the place. And it was an absolutely haphazard sort of process how you got people off drugs and alcohol. And I was shocked to find out that there was a procedure. There was a not well established yet, but a clinical procedure, and I became quite good at that. So people started asking me to see lots of these patients. And
Wait, what was the clinical procedure?
well, the a structured approach, a
Oh.
disciplined approach, evidence-based approach to taking people off particular substances when they're dependent. For instance, I was seeing it. Well into the early 2000s, I would see people in alcohol withdrawal getting Haldol.
Mm-hmm.
That was a common thing at the county facilities where I worked. And that's how you get an alcohol withdrawal to hover over the bed and have multiple seizures.
Mm-hmm.
Give them an antipsychotic like that, and you will make them so ill. And instead, we had a structured protocol for how to load people up on intermediate acting benzodiazepines or short acting benzodiazepines if they had liver disease, and a specific way of tapering them down over time. And then we had other, there was, a discipline to it. We gave them magnesium and thiamine and all the usual things, but it was done in a very, very systematic way.
What do you think about Alcoholics Anonymous? Are you a proponent?
To not be is mysterious to me. First of all, it's the cornerstone of every good treatment program. There's now 2 Cochrane studies, I think, and one for sure done by John Kelly at Harvard, showing that its benefit, if abstinence is your goal, 12-step mutual aid societies are more effective than any more effective or as effective as any professionally managed interventions. And it's free. And it's available 24/7. And why we wouldn't be advocating for free services that are measurably effective is shocking to me in a time when healthcare expense is a big deal. So our program was based in 12-step, and it was I went from being down in the unit to detoxing people from drugs, going, oh, I do the medicine here. What's that goofy stuff? All that stuff on the wall, those 12 steps. What is that goofy stuff? And then I watched some people recover and go from young people dying to better than they ever knew they could be. And I was so stunned to see those transformations. I just thought, I want to understand what this is, and became quite good at that eventually.
Do you have any thoughts on legalizing marijuana? Because I mean, my big concern with marijuana, and I have some family members with schizophrenia, is the potential for psychotic episodes. Yeah. Do you have any thoughts on that?
Oh, I have lots of thoughts. So I have tried to stay out of, as a physician, I don't feel it's my job to determine the laws.
Mm-hmm.
I have on the record that if anyone chooses to legalize it, there will be problems and I will deal with it. It will not be good. Strangely, when Colorado legalized cannabis, the only way we were able to get people's attention was by pointing out that the incidence of ER visits for dogs had skyrocketed because of ingestions of cannabis. We eventually saw that in California when that came in. And my daughter's a recovering cannabis addict, and I see cannabis addiction every day in that world. And I was a skeptic about the psychotogenic aspect of the drug. Back in the 90s, when it started coming up as a topic, I was like, I'm not really seeing that. I don't know. People got paranoid in withdrawal. They'd be very paranoid for about 2 weeks in cannabis withdrawal. But I thought, I don't know. It's probably people with schizophrenia who had a precipitated event or something. Now there's absolutely no doubt. It causes manic psychosis, 100%. Absolutely no doubt. And this is evident now because of the incredibly high concentrations that have come along in the legalized states as a result of the competition to get more market share. The concentration of the drug has gone higher and higher to the point where now we are categorically seeing psychosis, much higher incidence of addiction, particularly if you're doing dabs or concentrated wax, that sort of thing. And ERs are filled with 65-year-old plus having anticholinergic delirium from the high dose of cannabis, even with just single exposures.
Wow. Well, I'm glad I asked you that because, yeah, it's been no one ever talks about the psychosis with the addiction potential. Everybody's
Alex Berenson wrote the book. It's called "Tell Your Children," I believe it was called, and he wrote the book before the concentrations went up, and he made a big deal about this. And I actually was a little critical of it back in the day because I was like, I'm not sure. Now I'm sure. And when my daughter got sober from cannabis, she got her hands on that book. I don't know how. And she was furious with me. Why didn't you share this with me? Why didn't you show me? If you want to know how addiction works, I, of course, did. She didn't want to hear it back when she was using. So there you go. Anyway, she's a big advocate now and hasn't missed a meeting since the day she came home and started her sobriety.
What's the name of Alex Berenson's book?
I think it's called Tell Your Children. I will actually look it up for you.
Yeah, well, he doesn't believe in ivermectin, so yeah, but I'll read it. I'm curious.
I wish we would, you and I in particular, but even people like Alex Berenson would stop using words like believe and just start saying, I'm unconvinced by the literature I've read. Fine, you're unconvinced. Excellent. Mary's convinced. She will use it to the benefit of her patients, and it's well within her right as a practicing physician to do what she thinks is best for her patients. Okay, we disagree. There we go. End of story.
Yeah, you're right. That's a better way of putting it. I've actually tried to talk to Alex Berenson though, and he will not speak to me about it, which is unfortunate.
That is unfortunate. That's not like him. Usually he'll kind of talk about stuff. That's weird.
Yeah, Jillian Michaels invited him to come on a podcast with me and him and discuss things, and he did not respond. And I've asked him to, but anyway,
hang on. It is called "Tell Your Children the Truth About Marijuana, Mental Illness, and Violence."
Do you know how many states legalize it now?
I think it's 20, something like that.
It's over 20, I think.
Look, I feel about it kind of the way I feel about treating somebody with addiction. You can't force them into addiction. They have to prove it to themselves. Okay, I'm sorry. They're very dangerous. You're going to hurt yourself. You're going to hurt other people. But I'll be here to help when the time comes.
What have you seen in your career, things that you stood by early on, particularly with addiction medicine, that now you look back and say that was all wrong?
Well, certainly the way I thought about addiction when I was doing all that drug withdrawal, I thought addiction was about getting people off of the drugs, which is complete distortion. It's far more complicated, longer term proposition of healing the brain, rewiring the brain, dealing with the underlying influences and the crazy thinking associated with that disease. The other thing is my codependency was pretty severe at the beginning. And I kind of had that thing that people get when they see traumatized people, that they sort of feel, oh, my heart goes out for them. I feel so much. They're so slow. They're so, and of course, those traumatized people with the character pathology and addiction would just mop the floor with me, just use me however they needed to.
Right.
And it took a few of those for me to understand how that works, and how to set boundaries, and how to really manage people who are trauma survivor, particularly with character pathology.
Well,
Gosh,
I
I'm
have
sure
a funny story. My very first day out in the real world, and I joined a small practice, and I got this call on a Friday afternoon. This was back when we still had pagers. And it was, oh, it was my partner's patient saying that she ran out of pain medicine.
Oh,
And
perfect.
it gets worse though. So yeah,
Yeah, but only you can help me,
only I
doctor.
can.
Only you. You're the best doctor. The other doctors don't understand me the way you do.
No, I bought it hook, line, and sinker. Okay, it gets worse though because I was newly licensed and I couldn't. There was something where I couldn't do the electronic version, or I had to have the triplicate,
Yeah.
and I couldn't. And she could. I drove the triplicate to the pharmacy for this woman.
I've got
And
some good
then
therapists, Mary. I'm going to recommend you to.
well, hey, this was day one, and after that, I was,
I had to
no
do some
way, you were.
therapy. I had to do therapy. I knew I had to do it because I was dealing with, really uncanny population that was good. They were good at their stuff.
Right.
And so I did therapy for a number of years, and it really helped me. And now I've got like superpowers because I was the object of a sort of very intense trauma-based therapy. It makes me able to trust, in all these years of dealing with patients that just lie, and distort and manipulate, that I can trust when I'm working with a patient. I literally can trust anything that comes out of my mouth. It's the weirdest thing. I'll just tell you a story I like telling that sort of exemplifies it. I had this. Can I swear on this show? Because when you talk to addicts, it's always swearing, right?
Yeah. It goes live stream on X.
Okay. So I was dealing with this heroin addict who had come in after an overdose, really barely made it through. He's like a 28-year-old guy, and he was sitting. I feel like he was on the floor or something in my office, crying and sobbing. And his friend didn't make it. His friend died. He barely made it. It was his third life-threatening overdose, and he was like, I'm going to die. I know it. This is terrible. This disease is awful. I'm so tired. I'm just and he was in so much pain, and I could feel the pain he was in. The kid was really suffering, and I liked this kid. I treated him before, and I was very worried about him. And all of a sudden, without consulting my consciousness, my mouth went, yeah, I know. I'm sorry, but you were just so full of shit. I don't even know what to believe anymore. And he stopped, and he stopped in the middle. He stopped crying, and he looked at me, and he went, I know. How'd you know? I don't even know what's bullshit anymore. I don't know. And I thought, we can work. Let's just stay right there. Stay right there. I can see through. I can feel what's going on here. Don't trust anything you think, or don't trust anything. Just follow direction. And we were able to work together because of that.
Yeah. How long did it take you to become, sharp to all that?
15 years. A long time. Long time.
Whoa.
Long time. Yeah, long time. And years of therapy. And at the early on, another thing I thought I'd used to do was wrong. Really, realistically, 10 years. I was more confrontative, and confrontation is the enemy in most mental health situations. When you confront people, it just force shields go up, and that's the end of everything. You're just done. So this sort of Dr. Phil world of confrontation, while, and I mean no disrespect to Dr. Phil, he has an amazing talk show, but that kind of confrontative style is not psychotherapeutic, and it's good talk. It's not, and people got the idea that that's how you're supposed to deal with mental illness. And I think I even adopted a little bit of that, and that was not right. It was not good.
Well, yeah, but then there's this whole other side of it is, if you don't confront people, are you just enabling them? I mean,
we don't coddle them, and you
Right.
don't lie to them, and you don't. It's going to be more skillful for that. Look, the way you deal. This is a good advice for anybody else with drug addicts, alcoholics in their family. Use therapeutic wonderment. It is exceedingly effective with situations like this. It's like, I wonder if you've ever thought about, how you feel after you behave like that after you've been drinking. I wonder if you ever thought maybe it's the alcohol. I wonder if you ever just I wonder.
Mhm.
I'm wondering, and of course you know the answer,
Right.
but I'm wondering. It works every time. They just can't help but answer. They answer in a way that's more authentic and more realistic and gets them thinking and more motivated to make change.
And you use the I word, not the you word, right?
Correct.
Yeah.
Correct. But I just love the term therapeutic wonderment. It's just,
That's
I'm wondering, gosh, I wonder if you're drinking too much. And
what
you got to remember, denial is a very complicated process. It's not one thing, and it's not just lying, though certainly lying is involved with it. My charge nurse and I used to amuse ourselves. We'd need to ask a patient when they come into treatment. We'd see them, for their exam in the morning and stuff. And why are you here? What brings you here? What's your motivation? Where are we starting here? Just always a good place to start with these patients. And we over the years we started amusing ourselves with that question because the answers would be a million miles from reality. And I remember one guy we sat with, why did you decide to come in? Why now? Why right now? What's your motivation? And usually it's family or some legal problem or whatever. And this guy's like, you don't know how it's living like this is impossible. It's just so painful. I'm sick and tired of being sick and tired. I've been planning this forever and I'm just sick and tired. And this morning, that's it. I'm done. And I open the chart. There's a picture of him in 4-point chains brought in directly from the court.
mm,
Like, did the judge have anything to do with you being here? Oh, yeah, the judge, yeah, but I'm sick and tired. Yeah, okay, well, I'm sick and tired of it. I mean, it's a biological, it's anosognosia, right? It's the same thing as in stroke patients. They
mm.
literally distort reality so much that it becomes biological.
Do you think interventions work? Do people still do
Sorry,
those?
I
Do
think.
people? Yeah.
Say it again.
Oh, do you think interventions work? Do people still do those?
Yeah, they do. They do work in good hands with adequate resources, with long-term commitments, right? You can't just get somebody in for detox and expect that to make a difference. John Kelly has another bit of data out there that's sort of a dirty little secret in addiction medicine, which is that on average for a severe alcoholic, it takes 4 treatments. Wait, yeah, 4 treatments in 5 years to get 1 year of sobriety.
Wow.
So to
Huh.
have repeated requirements of treatment is actually routine. And
Wow.
so
That's
now,
hard.
on the other hand, if you spend a long period of time in treatment, the outcomes tend to be much better. By long, we're talking 6 months, 12 months, 24 months, that kind of thing.
What do you think about diet, the ketogenic diet for mental health? Have you looked at that at all or
Yeah, I
used
mean,
that?
it's the data. There's some remarkable data on mood, right? I again, people have to. There's kind of a weird thing going on right now, which is serious mental illness and serious medical illness is sort of left the conversation in some weird way. Everyone's got to remember, you're all going to get old, you're all going to get sick, you're all going to need medical intervention, real medical intervention, like full on, whether it's chemo for your leukemias or whatever it is. You're going to need the real deal stuff, unless you're nihilistic, you just want to let nature take its course. But most people don't do that, especially since we have such good treatments. Same thing is true of serious mental illness.
Mhm.
Serious mental illness is life threatening,
Right.
and you don't have time to fool around with diet. And we're really talking about milder forms of mood disturbances where yes, it does seem to have a significant effect on diet.
Yeah, I agree. People seem to be glossing over a lot of these major issues. And unless you've really dealt with somebody with serious mental illness firsthand, it's hard to imagine.
Most people
Um,
don't know what it is. They don't know
yeah.
what serious medical problems are either. We've done such a good job of putting at least keeping it in the hospital or treating it that people don't even understand what it is. I'm for instance, I have prostate cancer. I had a
Mhm.
prostatectomy 12 years ago, 14 years ago, something like that. And when I sat down with the surgeon, I did not want him talking about my diet. I did not want him talking about my management of my hypertension. I wanted to know what his complication rate was from his radical robotic prostatectomies. And his answer was zero. And when he said zero, I just want him doing operations all day, nothing
Right.
else. And I want him to do my operation. Thank you. And that's that.
Right.
And so we can't lose track of these highly skilled professionals. You know what I mean? I'm worried that we're throwing the baby out with the bathwater.
Yep, I completely agree. Are you seeing people microdosing LSD or
Sure,
what's
sure.
going on with that?
So that is some of the scariest stuff you can imagine. So LSD is the drug, one of the probably the drug that scares me the most because in having spent all those decades in the psychiatric hospital, I would see the consequences of the LSD. Right, people from the '60s that had significant LSD exposure, I ended up putting them in nursing homes.
Mm.
And they were not demented. They were just unable to manage their daily lives. They were profoundly depressed. It was a very odd syndrome. People that have modest LSD exposure typically would come in a year or 2 years later with personality changes and mood disturbances and memory problems.
Mm.
I've even seen normal pressure hydrocephalus from somebody who took a sheet of LSD trying to evade the cops. I mean, this drug is neurotoxic,
Mm-hmm.
clearly. And there's actually something called a theory called, I should say, a hypothesis called excitotoxicity, where the thought is that when you are pushing out neurochemicals at an extra physiological rate, this has been shown to be more the case in the setting of amphetamines. When you're
Mm-hmm.
pushing out the vesicles, particularly if the function, the mechanism is by accelerating the vesicular release of neurochemicals, neurotransmitters, the vesicles don't form as well. They sort of become dysfunctional in their formation, and the neurotransmitters get into the cytoplasm, and the neurotransmitters themselves become free radicals that destroy the cells. So this excessive stimulation, this idea, oh, you're just opening up pathways. These are things you're seeing reality, more reality, because this is all BS. You are damaging your brain. You're accelerating in a non-physiologic, non-natural way, and it is dangerous.
Right.
Could it have therapeutic benefit? Well, guess what? In end-of-life dread, when your life is only a few months left, it is shown to have real significant benefit. Then all these side effects aren't really that relevant, right?
Right.
By the same token, the microdosing, I have seen all kinds of problems with that. Eventually, the same kind of stuff starts happening, personality changes. And there's this odd literature out there that goes, well, yeah, we see the personality changes, but they seem happier. They seem to be more adjusted. And think about this. Think about the bioethics of people saying something like that.
Right.
It is one thing to say you or your personality is changing in a psychotherapeutic environment where you, the patient, are in control of these changes, as opposed to I put a chemical in my mouth and it made me a different person. That is a profound bioethical problem.
Right.
And the fact that we have literature that passes judgment on that it's been around for 30 years. It's disgusting. Then they have the psilocybins. And then the psilocybin is the one that's less dangerous, clearly.
Mm-hmm.
But even that, I've seen people doing it on a microdose daily basis, developing manias.
Mm-hmm.
So, okay, not good.
Mm-hmm.
Ibogaine or ayahuasca. Of course, all my heroin addicts want to go do that. All except for one, we're back at the heroin within 6 months. And I saw with that also some personality changes, and some of the trips were traumatic and life-altering in a negative way.
What
I'm
about
not using them for that. There may yet be one day use for them therapeutic in very difficult situations. I am gravely concerned about that category.
And what about ketamine? Are you seeing anything with that?
Ketamine is been shown clearly to be useful under and in the hands of an anesthesiologist, 3 or 6 exposures in recalcitrant depression, not as a first line treatment. Right. This use of esketamine, the inhalant afterwards, again, that literature looks confusing to me. This idea of doing ketamine therapy under the influence of ketamine looks completely concerning to me. I'm not convinced by that literature. So while ketamine is very useful, the way it's being used is concerning. And then finally, I've seen it trigger drug addicts. So if you have drug addiction in sobriety with recalcitrant depression, I would not suggest ketamine as a good idea.
Well, great. That debunks a lot of things flying around the internet now. Very, very interesting. We were going to talk about current events, but it went off.
Mary, 1 second. I want to say, when I go out and give lectures and stuff, I usually open with this. I'm a time traveler, everybody. I come to you from a different era.
Right.
I've
Right.
been 40 years in these fields, 4 decades. Across that time, I've seen these same ideas that are flying around now come and go and come and go. And some different ideas and some good ideas and some bad ideas. I've seen a million different ideas come and go. I'm a time traveler here in the present to share with you my wisdom as I come forward in time from a previous era. Please listen. I've seen a lot, and it is informative.
Exactly. I mean, that's why I asked you, because you learn as you go from your clinical experience, and to me, that's much more valuable than a journal article, because as you know, you can find an article to support anything you want.
And it got so backwards during COVID. I was saying this then too. It's like, wait a minute, the doctor's clinical opinion is everything. It's everything.
Right.
He or she then buttresses that opinion with the literature.
Right.
But
Exactly.
that his or her opinion should not be established strictly by the literature. It should be the literature, the experience, the follow up on the literature, but the experience is the paramount, and the judgment that comes from that experience is why you see a doctor, a physician.
Well said, and a great way to end. Thank you so much, Dr.
Quick.
Drew.
You got it. Thank you so much. Such a pleasure to be here. And the TWC guys sent me. And so thank you for the support of TWC. We appreciate it so much. That has been an incredible privilege to be part of that organization. They have really pushed medical freedom forward, it seems to me.
I agree. They are very like-minded, and they are the sponsors for the show. And I too am very grateful for their support.
Great. Wonderful. Thank you.
Thank you.